See the blood vessels coming off. So here's your brachiocephalic. Here's your right. Here's your brachiocephalic. Here's your left common carotid. Here's your left subclavian. So then I bring it back. Okay. If I follow the brachiocephalic, which is just that little piece, here's the right common carotid and the right subclavian. If I come up, the left common carotid. Common means it's going to split. When it goes to the inside, that's the internal carotid. The outside is the external carotid. This is the carotid sinus. This one is coming right across the face. This one is the facial. This one, see how it looks like it's going into the teeth? Okay? This is the maxillary, and right here is the superficial temporal. There's one coming around the back. That's the occipital. Now, if I come across the subclavian, the first one I come in the subclavian is this one. This is your vertebral. See how it comes up and comes right here? That's your basilar, right at the base of the brain. This is your right vertebral. This is your left vertebral, and they join up here in anastomosis and make the basilar. Next one I come to, see this one comes sneaking underneath right here? Right here, sneaks underneath, and then it comes in the front. This is the internal thoracic with the intercostals coming off. See the little pitchfork right here? That is the thyrocervical trunk. Right here is the axillary. If I follow it down, this is the brachial, radial, it's twisted. Radial artery, ulnar artery, superficial palmar arch, and the deep palmar arch. And that takes care of everything on the top. When we come to the bottom, go to the spleen and watch me. I'm going to follow the splenic in. See where it comes right here, right there? Follow the splenic in, it comes right there. That's the celiac trunk. See this one going to the right? That's the common hepatic. Okay, so if I follow the splenic in, it comes right to the celiac trunk. The one going to the liver, this is the common hepatic. See this little red wire right here? That's the left gastric. See this right gastric? It's coming off the common hepatic right there. See it? So that's coming around. So I have off the celiac trunk, I have the splenic, the left gastric, and the common hepatic. The right gastric comes off of the common hepatic. So that was the celiac trunk. Sam is this red one. See this red one right here? Coming in right there? That's the superior mesenteric. Here's the right renal. Here's the left renal. See that little bitty red wire right there? Right there, that little bitty red wire? That is one of the gonadals. Now remember, it's a gonadal if I don't give you a gender. It's ovarian if I tell you female, and testicular if I tell you male. See this red one right here? This red one. This red one right here, coming in right there, is the inferior mesenteric. And then if I turn this over, right here is your, right there is your middle sacral, coming right off the middle, okay? I follow the abdominal aorta down. This structure, this part right here where my finger is the common iliac. This goes to the inside, this is the internal iliac. This goes to the outside, it's the external iliac. I follow it down. This is the femoral, this is the popliteal. And then what I do, stick your hand right in here. Relax, that way. If I do it this way, then the one with his thumb is your anterior tibial. The one with his fingers is the posterior tibial, and the one behind your hand is the fibular. Then if I follow the anterior tibial down, right here is the dorsalis pedis. Okay? If I follow the posterior, see this red wire right here? That's the medial plantar, and that's the lateral plantar. Medial plantar, lateral plantar.
Lateral plantar is larger?
Yes,
Okay.
yes. Okay? You got it.